Welcome back, beautiful tri-state area. You're listening to a moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Up next in our Going Deep segment, brought to you by CO2 Lift, we're featuring Dr. Sheila Barbarino, an oculofacial plastics and full body cosmetic surgeon. She's the founder of Barbarino Surgical Arts. Driven by precision and amazing results, she shares her extensive expertise in compassionate care with practices in Austin, Texas, and Los Angeles. Now, we're not used to seeing the words menopause and makeover together, but the phrase may soon be as common as mommy makeover. Plastic surgeons are just starting to talk about menopause makeovers as a way to address bodily changes that we now know are caused by the normal hormonal shifts of menopause. There's no one procedure that is specific to menopause, but a patient who has long entertained the idea of a breast reduction may finally want to get one. Someone with implants may opt for a smaller size, or someone may get a breast lift to reshape their chest. From mommy makeovers to menopause makeovers, we're chatting non invasive carbon dioxide therapy for skin rejuvenation, the most requested surgical and non surgical procedures in her practice, and the pros and cons of injectables. Welcoming now to the show is the amazing and the beautiful Dr. Sheila Barbarino. Welcome to the show, Stunner.
Hi, good to see you.
So excited to have you on. So, can you tell us more about your background and what inspired you to specialize in cosmetic surgery, particularly with a focus on injectables, lasers, and aesthetic devices?
What really inspired me to focus on non-invasive as well as surgical techniques that could really help people quickly, and there's not a lot of recovery time. It's actually patient demand. Post-COVID, they have no patience for anything, no tolerance for anything. Everybody's go, go, go. And they want the same thing. They want a significant change with little downtime, little pain, little anything. They don't want to be in your office for very long. They don't want to have any downtime, and they want to go out that night and look fantastic and show off their new results, which is, the dream. It's the impossible dream, but it's the dream, right?
I love it. I love everything you're saying. We speak the same language. Now, carbon dioxide therapy, also known as carboxytherapy, involves the administration of carbon dioxide gas for various medical and cosmetic purposes. And in the context of skin rejuvenation, carboxytherapy is used to improve skin tone, texture, elasticity. The list goes on and on. So, what is non invasive carbon dioxide therapy, Sheila, and how does it contribute to skin rejuvenation? I mean, are there specific conditions or concerns that make patients more suitable candidates for this therapy?
So the best part is everyone's kind of a candidate for this. So I'll tell you my personal experience with CO2 mask when I first kind of brought it into my practice. So, I wanted to try it. I heard great things. We know, like you said, the science is there. We know that carbon dioxide has been used subdermally, intradermally, topically for many, many years to help with texture, tone, hydration. It really is kind of like a hyperbaric chamber for your face or wherever you apply it. And so, we all know the benefits of that, and it's very effective. But for me, my personal experience was I tried it, on a one-off, how good could this topical therapy be? And it was so funny. The day that I used it, I was having my makeup done, and my makeup artist that always does my makeup, my glam squad, God bless them. And they were like, Dr. B, what did you do to your skin? Like what new device are you using in your practice that your skin's significantly different than what we did when we did your makeup yesterday and last week? And I'm like, what? And they're like, yeah, it's fantastic. It's just taking the makeup. And I always say this even to my patients, my surgical patients, my non-invasive patients. There's so many patients that come in and they're like, oh, I just want to do, a facelift, but I don't really want to resurface the skin or use good skincare or whatever it is. And it's so funny because as a surgeon, yes, I can do amazing things in the OR. I can do amazing things procedural wise. But the problem is that if people don't take care of their skin, it's still old skin on top of new results, right? So it's people still don't look, it can't be a mishmash of, the skin being bad texture, because that shows your age, that shows, the sun damage, that shows your wear and tear every day. So what we want to do is obviously minimize that. And so
Yeah.
what's nice about the CO2 mask is it hydrates, it really gives that refreshed look. And so even though I do wear makeup, I wear makeup every day. Thank God for makeup. But, when you put nice makeup on old looking skin, it still looks bad. And I don't
Yeah,
care what anybody says. That's just, the facts. And so
it's a fact.
moving into, not just for looks and for show. I do very aggressive lasers in my practice. I do very aggressive peels, and I use CO2 lift every time at post procedure, and it really does decrease downtime. It decreases the redness, irritation, pain. It just really is that kind of turning point for the patient after using it, that it makes the procedure not so bad.
And it's interesting because carbon dioxide therapy is kind of a trending thing. We've been talking about it for the last, 6 months. But when you talk about, all the benefits from improved skin elasticity and firmness, reduction in the appearance of fine lines, I've been using it. The hydration and the radiance that comes with it. But pre-surgery applications are extremely important, right? To your point,
You
it
want
can
to
be
tee,
used
you want to tee up your skin so that you can heal quicker, heal faster, and actually the tissue texture and tone is easier to sew together, to heal when I bring it together with sutures. And when I do invasive procedures or non-invasive, skin is the first thing we see when you look at anybody. And so I think that's the most important thing to address and tend to. I'm only giving them this much of their result with everything that I can do. And then they've got to take care of it and maintain it and make the skin look good. Because
Yes, and
that's
menopause what they're calling now menopause makeovers and all the lifts, face, breast, and neck are set to dominate plastic surgery in 2024 as patients and doctors are chasing the more natural looking and
yeah,
addressing the after effects of Ozempic. There's been a 19% increase in total procedures performed since 2019,
absolutely.
and that's according to the American Society of Plastic Surgeons, and more of us are talking about it. Now, let's shift to the most requested surgical and non-surgical procedures. So in your practice, what are the most requested surgical procedures and what makes them so popular? And similarly, what non-surgical procedures do patients frequently seek and what benefits do they offer compared to traditional surgical options? But under 3 minutes.
Ah, go. So let me dissect your big question one by one. So most surgical procedure that's being requested right now, I believe, is blepharoplasties and brow pexy, under eye lifts, eye lifts in general. That is probably the number one. Probably number two is a lip lift, which is really surprising because it was kind of out of vogue and now it's back in vogue because I think people, like you said, are kind of moving a little bit away from fillers. And so they want something that's going to be a little bit more of a permanent result and a little bit more of a natural result, which lip lift gives. I think the reason why people are going straight to an eyelid surgery is because number one, you know, the eyes are the window of the soul. It's the first thing you see, especially us as women. Every day when we apply our mascara or put on our eye makeup, that's what we notice and that's what bothers us the most, right? And I also think it's a surgery that has very little downtime, right? It really is, an hour, maybe an hour and a half or less in the operating room. People always look better right afterwards. I don't care how bruised you are. All of my patients are like, gosh, I look so much better. And we just did an hour ago, and
Yeah.
that's how everyone should feel. And that's why I think that the eyelid surgery is so popular. There's so much focus on the eyes as far as non-invasive treatments that people are requesting are like, kind of like what you said. So number one, thread lifting procedures are really big right now. I think it's because people do have a little bit of filler fatigue. I don't think threads at all get rid of fillers. They do two different things. Threads lift tissue and filler fills volume. You kind of need both. I always say 99.9% of patients need threads and filler, and of course neuromodulator to stop the wrinkle. So all three of those are really the ideal way of taking care of your skin. But I think peels and skin boosters are huge. Biostimulators, like you said, people really want to look natural, but they don't want to look old.
No, and many
one wants
younger
to look old.
Yeah, and many younger people who have gotten used to appearance changes after dabbling in fillers in their 20s and 30s are asking about procedures historically tailored for the over 50 demographic. And while a 40-year-old may not be a candidate for a traditional neck lift, a new twist on classic procedures is gaining steam, right? So over the last 4 years, the number of breast reductions has shot up by 54%, and the most requested implant sizes have gotten smaller. 5 years ago, everybody wanted to be a D cup. Now it's a large B, a small C, right? So to your point, shifting to more natural. Now, let's talk about cost effective non surgical facelift. So many individuals are interested in non surgical facelift options. What, in your experience, is the most cost effective way to achieve that non surgical facelift?
There's so many ways these days. That's what's the best part. So there's fillers, there's thread lifting, there's radio frequencies, there's microneedling, there's all these different ways, and we can attack it on so many different um, areas that can really lift and tighten and make us look. There's hyperdilute radius, there's Sculptra, there's all these biostimulators, there's injectable like I said, skin boosters that, everyone's kind of become accustomed to taking glutathione and all these vitamins and getting IV infusions. Now we can infuse into our skin directly, and it just makes everyone look more beautiful, more radiant, stimulating collagen, not just for today, but for in the years to come. Who doesn't want to invest in looking good for the years to come and looking good today?
Yeah, I agree. I agree. I'm all about longevity and doing it the natural way and aging gracefully, which is why I want to talk about the pros and cons of injectables. So, injectable treatments are still very widely sought after. What, in your opinion, are the key advantages of injectables for facial rejuvenation? And then, on the flip side, what are the potential drawbacks or the cons that patients should consider when opting for injectable treatments?
The pros of uh, injectables are instant gratification. Oftentimes, it will make you look more youthful, more rejuvenated. It really does hydrate your skin. Oftentimes, all of the injectables have a natural tendency to increase collagen just from this needle stimulation, as well as the hyaluronic acid drawing the water in to make your face look supple, or whatever area you inject supple, and kind of place structures or fat pads and things that were there when you were youthful and younger, put them back where they should be. So that's the pros. The cons are that we're learning is that, sometimes people can get over injected, as we all know. And that's, I call it marshmallow pillow face. It's not a good look. Nobody wants to look fake. But what's really great is our science has become so advanced that we're catching up to, we want more natural looking hyaluronic acid and more natural looking injectables that really move with our movements. So not every time we move, we see the filler, or you can look at someone now and you're not sure if they had filler. That's the look we're going for. Not that, wow, she's got her lips done. That looks a little crazy. As well as hollowness underneath our eyes, it can restore. Fillers are fantastic. And all of us need them, and they're just like the magic sauce. But cons, there's, with everything, there's a danger to injectables. They're not risk-free. You can have vascular occlusions. You can have very rare cases of blindness. So you just have to be really careful. Make sure your provider is credentialed, that they're an experienced injector, that they know what they're doing. And then I think the most experienced injector can have complications just like anybody else. But what makes them an expert is that they know how to get themselves out of trouble and can help you if you were to have that complication. So that's what you really want to go to, is someone that knows how to deal with the problems in case they arise. Because problems arise all the time, whether you're good or you're not good, and it's how you deal with them.
Well, that's the reassuring part. Now, in your experience, how does informed and empowered decision making contribute to overall patient satisfaction?
Oh my God, I love an informed patient. It's so funny. There's so many of my friends that are like, oh, Google's going to kill us. It's going to kill my soul, because they come in and they have like a long list of, I like it because I feel like they can educate themselves to a certain point. Is everything on the internet correct? Absolutely not. Most of it's false, but it's nice to have that rapport with your patients that they can ask you questions and that you can answer them honestly, sincerely, and assure them of what their outcome is going to be. Because you're right, no procedure is without risk. And so for them to be aware of the risks are very important. I know a lot of people sometimes are like, I don't want to know. I don't want to worry about it. I get anxiety anyway. But the truth is that if it were to happen, you want them to know that this was a possibility, and now we just have to deal with it together.
Exactly, exactly. And I've seen a lot of situations where I know the lead injectors that train, they're from Allergan, the lead trainers. And the one thing they say is like some of these patients who have gone to inexperienced hands have even hypertrophic scarring. It can occur with superficial
Absolutely.
placement of fistula. And then there's migration or sterile abscess or what was the other one she said? It
Look
was a
at you. You
it was
know, you know all of them. I love it.
hold on. It was similar to a Greek word. It was telangiectasia.
Telangiectasia.
Yes, that's it. That's it.
Telangiectasia. Yes,
Telangiec
yes.
Yes. So
Yes,
yeah, I
it
read.
can cause broken blood vessels. 100%. I love it. See, I love an educated. It's so much more interesting to me as a practitioner to talk to someone that knows what they're talking about, because it's a great starting point, and then we can move forward with whatever treatment or whatever. An educated patient, an informed patient is always makes me feel better about moving forward. When I have patients that just don't understand it or just don't get it, I think that's when I tend to say, you know what, I want to step away from
Yeah, it
that.
puts a lot of pressure on you because now you're trying not only to come up with solutions for them, but educate them and then come up with the solutions. And then it's a different process versus they come in, they're informed, they've done their research, you're speaking kind of the same language. Well, we are officially out of time. I want to thank you so much for coming on and chatting
You're
with
lovely.
me.
Anytime.
All right. Well, you are invited as my expert on the microphone, trailblazing woman. I love your transparency, and I love that you are so well educated and so just able to have a conversation. Right? It's amazing that you are so passionate about your craft that you could probably officially speak longer than I can.
I love it. Yes, I drink the Kool-Aid. I sell the Kool-Aid every day. I love it. I love what I do, and it's such an honor to do what I do. So, and I hope to meet you someday in New York.
That was our Going Deep segment brought to you by CO2 Lift. Check her out. She's amazing. BarbarinoSurgicalArts.com, where you can check her out on the gram at Barbarino Surgical Arts. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2 Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2 Lift. CO2 Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase luminosity, and improve pigmentation, sagging, skin tone, and radiance. For more information or to order CO2 Lift, go to CO2lift.com.